Hi everyone, I'm Katie, and my presentation will cover gut microbiome composition and metabolic activity in women with diverticulitis. I'd like to just briefly state that I selected the study because of the parallels it draws to my mom's recent diagnosis in the hopes I could offer her some relief. However, diverticulitis is still not well understood, and I'll unfortunately be telling her I'm no closer to curing her. In this presentation, I will discuss the background, including what diverticulitis is, its pathogenesis, and how it's currently being treated. I'll cover the study I chose, its design, methods, and results, as well as limitations, major conclusions, and future directions. Finally, I will pose my discussion questions where I look forward to seeing your perspectives. Diverticulitis begins with a condition known as diverticulosis, the development of mostly symptom-free and often innumerable small pouches of the colon's inner wall. 2/3 of U.S. adults aged 70 years or older have diverticulosis, but risk of development increases after age 40. In some individuals, these small pouches become inflamed, causing diverticulitis, which can result in complications such as obstruction, abscess formation, or peritonitis, which is when an infected pouch bursts, allowing colonic bacteria to flow into the abdomen. Pathogenesis of diverticulosis and diverticulitis remain largely unknown. However, symptoms, inflammatory changes, and histological features of diverticulitis present similar to those of inflammatory bowel disease and irritable bowel syndrome. Because disruptions in the gut microbiome are recognized as an etiological factor of these disorders, recent theories of similar associations between gut microbiota and diverticulitis are beginning to emerge. Furthermore, diverticulitis is consistently linked to fiber intake. Therefore, assessment of its possible role is discussed. Current treatment is limited and is usually administered via antibiotics, although in some severe, complicated cases, surgery to remove the affected colon may be recommended. The study titled Gut Microbiome Composition and Metabolic Activity in Women with Diverticulitis was conducted by Wenjie et al. And published in the journal Nature on April 29, 2024. It aimed to shed light on the etiopathogenesis of this understudied condition and to encourage the development of personalized microbiome-informed dietary interventions and/or the manipulation of the microbiota in preventing and treating diverticulitis. The researchers used a nested case control study compiling the largest investigation of gut microbial disruption in diverticulitis to date. It thoroughly analyzed how specific gut microbiome species and their associated metabolites influence the metabolism of participants with and without diverticulitis. It also examined the roles that dietary fiber and adherence to a prudent diet versus a westernized diet may have on diverticulitis. Specifically, it analyzed the effects of dietary metabolites on bacterial composition and those produced through bacterial nutrient digestion and how both metabolites influence diverticulitis. Participants were from the Nurses Health Study 2, or the NHS2, which is an ongoing prospective cohort of 116,429 female nurses between the ages of 25 and 42. In February of 2019, NHS2 launched the Microbiome Among Nurses, or MicroN project, from which stool samples were obtained. According to age, sex, and month of collection, they matched 121 patients with incident diverticulitis requiring antibiotics and/or hospitalization to 121 patients without, for a total of 242 participants. Diverticulitis-free participants were the controls. Ongoing questionnaires from 1991 assessed diet intake, while 2019 MicroN questionnaires identified diverticulitis and diverticulitis-free participants. Shotgun metagenomics sequencing and untargeted metabolomics profiling were used to sequence and analyze individual microbiota genomes and their associated metabolites and characteristics. Microbiota composition, functions, and metabolic activity of diverticulitis diagnosed participants were then compared to the controls. Researchers found that overall microbial community structure differed slightly yet significantly between diverticulitis participants and the controls. Enrichment of pro-inflammatory Ruminococcus navis 1,7-dimethyluric acid and histidine-related metabolites, as well as the depletion of anti-inflammatory ceramides and butyrate-producing bacteria like Faecalibacterium in diverticulitis were observed. Butyrate, a short-chain fatty acid product of colonic bacterial fiber fermentation, is a primary fuel source for colonic epithelial cells, highlighting the possible necessity for promoting these bacteria and preventing diverticulitis. This chart displays the relative abundances of the top 20 bacterial genera in diverticulitis versus the controls. While it's difficult to see the differences in pro-inflammatory Ruminococcus, diminished beneficial butyrate-producing Faecalibacterium in diverticulitis is clear. If you look closely, Faecalibacterium is represented in dark blue above the Bacteroides in red, and you can see the diminishment of the Faecalibacterium. Covarying metagenomic and untargeted metabolomic analysis revealed bacterial and metabolite specificity to diverticulitis, namely Bilophila wadsworthia and certain bile acids. In the presence of bile acids, these bacteria are known for their sulfate reduction capacity, in which hydrogen produced by bacterial fermentation is used to reduce sulfate to hydrogen sulfide. This process balances partial hydrogen pressure of the GI for continued fiber fermentation, and with the help of hydrogen sulfide, aids in colonic cell nutrient absorption. In this scatter plot, we see that Bilophila wadsworthia was positively associated with alpha myricholic and cholic bile acids, but inversely associated in diverticulitis. This outcome indicates the potential risk of reducing Bilophila wadsworthia population through disruption of intestinal hydrogen pressure homeostasis and hydrogen sulfide production, which can result in the reduction of fiber fermentation and decreased nutrient absorption of colonic epithelial cells. Ultimately, it was observed that microbial composition alters the protective relationship between a prudent fiber-rich diet on microbial health and diverticulitis. While this study is relevant with many strengths, like all studies, it contains some limitations. First, this study focused on stool microbiome, which may not capture the entire picture. To facilitate large-scale analysis, stool and mucosal microbial communities should be examined for defining interpersonal differences in gut microbial ecology, although colonoscopy is usually avoided in the acute episode, making relevant biopsies difficult to obtain. Secondly, because the study design was based on individuals sharing common characteristics, access to medical records for all cases of diverticulitis was infeasible. This limited the ability to determine the exact timing of diagnosis for each participant. Third, the researchers did not have accurate information on whether controls were diverticulitis free. However, because prior colonoscopy-based studies lack a specific microbial signature in the mucosa of asymptomatic diverticulitis, the disruptions of the microbiota composition and metabolic activity observed in this study may reveal changes to diverticula formation and inflammation. Finally, this study excluded men, and because the microbiome can vary between women and men, research involving men is necessary to validate the study's findings. Major conclusions found that gut microbiome species modify the protective effects of fiber on diverticulitis, specifically in inflammation and short-chain fatty acid and bile acid metabolism. And consistent with the researchers' previous findings in prior epidemiological studies, greater dietary fiber intake was found to be associated with decreased risk of developing diverticulitis. Future directions should include research using validation among a broader range of populations and well-designed prospective investigations. These will be essential for generalizing the findings and making recommendations to whole populations. Moreover, future studies to examine the prospective role of metabolites and the microbiota in developing diverticulitis are warranted. Here are my discussion questions. I look forward to seeing your responses on the discussion board. Thank you for taking the time to watch this presentation, and I hope you enjoyed.